Hello, it's Dr. Rhonda Johnson, and today is Friday, August 7th, 2020. And guess what I'm going to be talking about today? Face masks and the importance of wearing a facial covering when you're out in public. I'm going to be referencing a study that was released yesterday. You know, we have the highest death rate in the world from COVID-19, and the Institute for Health Metrics and Evaluation from the University of Washington School of Medicine has done a lot of predictions that our government uses to estimate the magnitude of this pandemic. And they released a report yesterday that says that by December 1st, our death toll is expected to reach nearly 300,000 people. However, starting today, if 95% of us Americans would wear a face mask when we left our homes, we could save 70,000 lives. That's a lot of lives, and that's worth trying to save, in my opinion. Now, what do face masks do in this fight against COVID-19? Well, they create a barrier for your mouth and your nose, simply put. By creating that barrier, it keeps you from inhaling and taking in those respiratory droplets that are generated when people cough, sneeze, and just through talking. So it creates that barrier that protects you and it protects other people. But the best mask for you is the one that you will wear. You have to be able to breathe comfortably while wearing your mask. So again, your mask has got to fit right. It's got to go below your chin. It has to hit above your nose. Your nose and your mouth must be covered. And make sure it's as snug against your cheeks as possible. Now, my face mask that I have on now, it's not completely airtight because it gaps when I talk like this. But again, it's a combination of the mask plus social distancing at 6 feet apart that's going to give you the maximum amount of protection. So wear your face mask. Now, a lot of people are wearing all kind of masks. You see all kind of masks out in public. High fashion. People have messages on their mask. Particularly the cloth masks. They've got team sports. They have inspirational messages. They have bling. They have all kind of things. But you want to make sure that your mask is doing the job that it's supposed to do. So there are a couple ways that you can test your mask for effectiveness. Now, I do want to offer a disclaimer. Some people say this is just BS. It's not science at all. But I saw Dr. Sanjay Gupta do this on CNN many, many times. So I figured if Dr. Gupta does it, there must be some legitimacy to it. Whether it is or not, I don't know. But according to Dr. Gupta, you can test your mask to see if it's effective. Because again, we recommend a 2 or 3 ply mask. That means I wear a 3-ply disposable mask because that works best for me. I can breathe out of this one. I can walk. I can be in this mask for prolonged periods of time. And so I wanted to test it because again, it says it's 3-ply, but I don't know that it really is. But Dr. Gupta says that you should be able to blow a candle out with your mask on and the candle not be extinguished. So meaning if you try to blow a candle, you shouldn't be able to blow the candles out. So I have my phone in my hand. Let's see how I can do this. So I'm going to try to blow out this candle wearing my face mask. Now I'll stand up. Maybe that'll do it. So you can see. Apologize here. Trying to get this angle right. Now I can feel the heat from the candle. Now you can see I've tried to blow this candle out several times with my mask, and yet the candle remains lit. So my mask is doing the job. Now I'm going to take this mask off. Always take it off by the ears. And again, if you're wearing your mask down here, it's not doing you any good. If you're wearing your mask on your chin, it's not doing you any good, folks. You got to put it above your nose and your mouth. Okay, blew out the candle. The candle is gone. So test your mask. You can also test your mask wearing water and not wearing water, obviously. Pour some water on the inside of your mask. And if the water doesn't come through to the other side, then you know your mask is giving you the protection that you need. Now, who should not wear a mask, or when should masks not be worn? We all know now that children younger than 2 do not put a mask on a child that's younger than 2. Anyone who has trouble breathing, now that needs to be legitimate. And you really, to me, have to have trouble breathing before you can't wear a mask. But nonetheless, if you're someone who says you have trouble breathing, well, you may just want to be careful about going out in public as well. Anyone who's unconscious, incapacitated, otherwise unable to remove the mask without assistance should not wear a mask. You also don't need to wear a mask if you're engaged in water activities like being in the water at the beach or the pool, because a wet mask may make it difficulty to breathe. And if you're also at the beach, in the water, you want to make sure you're 6 feet apart, except for parents. Please stay close to your small children. Now, people who are engaged in high-intensity activities like running may not also be able to tolerate wearing a mask if it causes difficulty breathing. And again, just stay 6 feet apart from someone else, and you should be okay. So again, the mask plus the distance. Wear the mask when you're out in public. And I've heard people say, I can't keep it on that long. Well, let's say you're in the grocery store and you're walking and you're getting your groceries and there's nobody near you and you feel you can't breathe. Well, take a second and take your mask off, just enough so you can get your breath, and then put your mask back on. We have to have some common sense, but you want to make sure you're wearing your mask when it's most needed, and that's out in public. Now, again, it's a combination of 3 W's. Wear your mask, wash your hands, and watch your distance. That gives you the most prevention against COVID-19. I hope this has been helpful. I cannot stress how important it is to save lives during this pandemic. Have a blessed day. This is Dr. Rhonda Johnson, and my views are my own.